Hello, my name is Bikash. Today I'm going to give a presentation about self-injurious. Okay. What is self-injurious? Self-injurious behavior is one of the most devastating behaviors exhibited by people with developmental disabilities. The most common forms of these behaviors include head banging, hand biting, and excessive self-rubbing, grinding teeth, scratching, and eating non-edible food. There are many possible reasons why a person may engage in self-injurious behavior, ranging from biochemical to the social environment. Cases of self-injurious behavior are common in routine clinical practice. It is defined as commission of deliberate injury to one's own body done without the aid of the other person and is severe enough to cause tissue damage. There is no one particular or simple cause that leads someone to self-injure. In general, self-injury may result from poor coping skills. Non-suicidal self-injury is usually the result of an inability to cope in healthy ways with psychological pain. Difficulty managing emotions. The person has a hard time regulating, expressing, or understanding emotions. The mix of emotions that triggers self-injury is complex. For instance, there may be feelings of worthlessness, loneliness, panic, anger, guilt, rejection, self-hatred, or confused sexuality. Through self-injury, the person may be trying to manage or reduce severe distress or anxiety and provide a sense of relief, provide a distraction from painful emotion through physical pain, feel a sense of control over his or her body, feelings, or life situation, feel something, anything, even if it is physical pain when feeling emotionally empty, express internal feelings in an internal way, communicate depression or distressful feeling to the outside world, be punished for perceived faults. Self-injurious has been variously termed as deliberate self-harm, superficial moderate self-mutilation, parasuicide, self-wounding, autoaggression, and purposive accident. Clinical manifestation of self-injurious behavior. Sign and symptom of self-injurious. It can be challenging to know when a loved one or friend is engaging in self-harming behavior because it is often done in private. The sign and symptom of self-injury will vary depending upon the method a person uses and may include behavioral symptoms, wearing long pants and long sleeve shirts even on hot days, brushing off injuries as frequent accidents or because of being clumsy, needing to spend a lot of time alone, challenging with friendship and romantic relationship, keeping sharp object or implement of self-injury on hand, withdrawing from one's enjoyed activities, unpredictable impulsive behaviors. Physical symptom: scars, fresh scratches or cuts, bruises, broken bones, patches of missing hair. Cognitive symptoms: ongoing question about personal identity, hopelessness, worthlessness. Psychological symptoms: emotional numbing, emotional instability, mood swings, depression, increased anxiety, especially when unable to self-injure, guilt, shame, disgust. Treatment. There is no one best way to treat self-injurious behavior, but the first step is to tell someone so you can get help. Treatment is based on a specific issue and any related mental health disorders one might have, such as depression. Because self-injury can become a major part of one's life, it is best to get treatment from a mental health professional experienced in self-injurious behavior. If the self-injurious behavior is associated with a mental health disorder, such as depression or borderline personality disorder, the treatment plan focuses on that disorder as well as the self-injurious behavior. Treating self-injurious behavior can take time, hard work, and one's own desire to recover. There are some person-centered strategies for the management of self-injurious behavior. Psychotherapy, known as talk therapy or psychological counseling. Psychotherapy can be helpful. Identify and manage underlying issue that triggers self-injuring behavior. Learn skill to better manage distress. Learn how to regulate emotions. Learn how to boost self-image. Develop skills to improve relationship and social skills. Develop healthy problem-solving skills. Several types of individual psychotherapy may be helpful too. Cognitive behavioral therapy, which helps you identify unhealthy, negative beliefs and behaviors and replace them with healthy, adaptive ones. Dialectical behavior therapy, a type of cognitive behavior therapy that teaches behavioral skill which helps to tolerate distress, manage or regulate emotions, and improve relationship with others. Mindfulness-based therapy, which helps to live in the present appropriately, perceive the thoughts and action of those around you to reduce your anxiety and depression and improve your general well-being. In addition to individual therapy sessions, family therapy or group therapy also may be recommended. Medications. There are no medications to specifically treat self-injurious behavior. However, when one is diagnosed with a mental health disorder, such as depression or an anxiety disorder, doctor may recommend antidepressant or other medications to treat the underlying disorder that is associated with self-injury. Treatment for those disorders may help to feel less compelled to self-harm. Thank you.